Okay, so 5 measures to prevent hypothermia. Okay, you guys know those. Go review those. They come readily. Name the 3 types of newborn jaundice. Type of jaundice, is it abnormal or normal? Day of occurrence and treatment. So then I have this little chart here for you. Okay, this chart will really help you identify the type. By the timing of jaundice is going to tell you what's causing it, what type of jaundice it is and what's causing it, which in turn is going to tell you what I keep saying. Your nursing care. Okay, you got to figure this out first before you're going to be able to answer what is my nursing care going to be. Okay, all right. PKU. It's misleading because there are several different tests performed, not just the PKU screen. Name the 4 test categories. Now there's more in some states, but the typical 4 are these. All right, so it's a newborn screen. So metabolic is what we typically think about PKU. And we know that if a baby does not have the enzyme to digest phenylalanine, and we give baby milk where there's phenylalanine in it, it can, if their body can't metabolize it, it can give them brain damage. Okay. An endocrine disorder, we find out if there's a thyroid issue right at birth, we find it out right away so that we can get that baby on thyroid supplementation so that, number one, he grows normally because the thyroid is the gland that helps you grow, and that it doesn't cause any developmental issues or other physical issues. Okay, hemoglobin and cystic fibrosis. All right, so just things you need to understand about the PKU or the newborn screen. Okay, name 7 considerations related to circumcision. Okay, and all that, I'm skipping through some of it, but you guys do need to read through it. So obviously we need a written consent, a circ board. You must secure the infant, console the infant, pacifier, oral sucrose, the GOMCO, what you're going to use, Plastivel, what you're going to use or not use, what happens with that. Baby's got to urinate within 6 to 8 hours. And then monitor for bleeding. Okay. And then this has the newborn reflexes a little bit more succinct than that other page did. All right. Now, the last thing I'm going to talk about is post-maturity. This is something this is in your slides, and please do look at the end of your slides because I think it will help. You can read your notes, you can read the text, but make sure you understand this. So we have preterm, we have term, we have post-term, and then we have the post-mature baby. So post-term would be after 40 weeks, but the post-mature baby is infants after 42 weeks gestation. So post-term would be 40 to 42. After 42, we have post-maturity. We don't have many of these babies anymore. We used to have more. And the cause is because, remember, we talked about the fact in the beginning of class that the placenta is the only known organ that has a timed life span of time that it lives, and then it starts infarcting and dying slowly. So if the placenta starts infarcting for whatever reason, could be mom's diet, could be her hypertension, could be her diabetes, but if that starts performing poorly, then that baby's not getting the perfusion. IUGR could occur, baby loses weight, and because it's not perfusing, baby's got hypoxia and baby's got malnutrition. Okay. Now remember when we were up here and it said right here, asphyxia, causes of low blood sugar in the newborn, asphyxia. Okay, now let's come back down here. And hypoxia and malnutrition. So this baby is going to come out having several issues. It's going to come out having possibly a low blood glucose. It could come out losing weight, having lost weight, because it's hypoxic inside. Okay. Baby needs more oxygen. So baby's body tends to try and compensate. And the compensating that baby does is produces more red blood cells. They're immature red blood cells, but that's how he's trying to compensate to get more oxygen carrying cells to the different organs. So you can read through these, but if we jump down here, so that baby that has that increased red blood cell count, when he's born, he gets this ruddy skin color from all the polycythemia that he was trying to compensate with inside. And so what does this trigger in your mind, knowing he's compensated, he's got polycythemia now, he's separated from mom. Now what do we have to anticipate? Jaundice. Okay, so you can see how, there'd be a great question there to build upon each other. And it's just stuff that you have to kind of think through. It's really not hard, but you have to know it well so that you can think through it. Okay, and then these babies come out looking like these hyper alert, wide-eyed, worried look. They look like these little old men with wrinkles on their foreheads, and they've lost weight. And that's why they look that way. They've lost weight. Okay, read through those, understand that. Okay, and then we talk about post-mature infant. What will you monitor? What complications? Well, thermal regulation. They'd be cold because they've lost weight, and they've lost their brown fat. Brown fat is that vascular fat that keeps them well insulated. And that is the first thing that starts being oxidized if they are in an increased metabolic state, a stressed state. And then, of course, the glucose, meconium aspiration. Okay, if they're IUGR hypoxic, hypoxia causes them to have a bowel movement, a vasovagal response inside, and neurological signs from hypoxia, seizures, potentially, and acidosis. So the acidosis, where does that come from? Well, a lot of it comes from that oxidized brown fat, the oxidized brown fatty acids. They're fatty acids. And so a lot of acidosis comes from that, as well as the hypoxia. All right, now we have symmetric and asymmetric. And I want you to know the difference between these two. When we think of an adult, when you are in your med-surg adult patient's room, okay, we always, especially for a stroke patient, we always check and compare side to side, okay? Squeeze my fingers. Let me see what strength is side to side. Can you push? Can you pull? Can you lift your toes? Can you push your feet down? How does it feel from side to side? Pedal pulses. I can feel it on this side, but I can't feel it on that side. All right. That's symmetry in the adult assessment. Symmetry in the baby assessment is head to the rest of the body. Okay. Is the head symmetrical to the rest of the body? And the reason this is so is that we talked about this when we first talked about the growing fetus. Remember those early ultrasounds that I showed you guys? And there you could see the head first, and you could see the little trunk of the body, but you could see the head. Okay, so the head grew first, and then the trunk catches up with the head. Okay, and then they grow. Well, in a baby, a symmetric baby would be where the head is in proportion to the body weight and the size. Okay, so a baby could be symmetrically small, okay, and a baby could be asymmetrically small. So let's talk about asymmetric. Asymmetric now would be where, since the head grows first, the head stays big. Okay, the head doesn't lose weight, the body loses weight. So head circumference is normal, the body from IUGR, okay, diabetes, hypertension, the body loses weight. So abdominal circumference weight are low, okay? And it seems like the head seems large for the body. So symmetric, baby just is small symmetrically, head versus body. Asymmetric, head is big, body is small. The body has lost the weight. When baby loses their weight, the body loses first, okay? And then I've listed for you here, if it is asymmetric, usually it's mom issues that cause this. If it's symmetric, small babies, usually it's fetal factors like twins, okay? So they're symmetrically small. If it's asymmetric, it's usually uterine or maternal factors, being PIH, diabetes, mom has these illnesses, mom's smoking, mom's taking Coke, and causes this vasoconstriction that causes the baby to lose weight. Okay. So I tend to like to think about it as, if it's symmetrical, usually it's a normal thing, twins. If it's asymmetrical, it's something that is wrong with mom's body that's affecting the baby now to lose the weight he once gained. All right, and then you can read through these. Okay, gives you more reasons. And then the last 2 pages, you guys, are the gestational age charts. So you can see, if I give you a baby that's just laying there and limp, as opposed to a baby who's laying there and has his arms and his legs flexed, and I were to say which one is more mature, you would be able to say this one is more mature. So you'd have to kind of know all of these, okay? I know that there's a lot of words down here. Don't let that, scare you away. Just get the overall picture of what it looks like. You, in the plantar surfaces, their skin is shiny, translucent, and not a lot of creases. Well, as the infant grows, they've got more creases, 2/3 of the foot over the entire sole. They've got a bigger foot, they've got more adipose tissue, and they've been sitting in that 9 months of water a lot longer. So they look like we do when we've been in a bathtub for a long time. Okay, so that's all I got for you. I hope that that was helpful, you guys. Do all the other stuff that we mentioned, and then make sure you can answer, especially with the newborn, make sure you can answer these. The other slides for postpartum and postpartum complications are helpful too, okay? And let me know if you need anything, okay? I'm gonna stop sharing my screen so I can see y'all. Okay, my friends. Was that helpful? I hope. Yes, no, maybe so. Okay, let's hope so. Okay, if you have any questions, reach out. Okay, hang in there. This too shall pass. I promise you. But I'm hoping that this would help today.